Hey everybody, just wanted to give an update on how I'm feeling. So apparently the surgery didn't go off without a hitch. No chemo port was installed, even though, as you can see, I have the chemo site. The port site. I have a chest tube in me right now to stop my lung from collapsing during the surgery. They stopped. So they didn't do the biopsy either. And this chest tube is pain like unreal. I'm able to talk to you because I'm just a trooper. That's why. But when I hit that chest tube in the wrong position, no. My husband's been a saint. I'm being so mean. I'm sorry. I'm just irritable. So I'm a little frustrated right now. So just keep me in prayer because nothing got done. Because they had to have a team of vascular surgeons come in and some other kind of people come in.
Three multiple types of teams.
Three different teams came in because
Your operating room was full of doctors.
Because my blood pressure went down very low. They don't like to say those words, but it went down really low, and so they had to have multiple teams come in and work on me, put the chest tube in, and now I'm just relaxing, trying to. I'm on some great stuff, Dilaudid and all that stuff, but nothing takes away the pain of a chest tube. So anyway, love you guys. Keep me in prayer. Staying here overnight, obviously. Don't know what the plan is because the port site's messed up now, so not really sure how it's going to work out. All right. Love you guys. Survivor mode. Hey everybody, it's about 12:30 in the morning on September 2nd, and just want to check in. I know you guys are worried about me, and I appreciate the love and concern. My fabulous husband is over here. Where is he at? There he is. Taking some serious beatings from me because I'm in pain. So apparently the surgery did not go as planned. They went to do the port first, and my lung either partially collapsed. Something happened. Either way, I have a chest tube inside of me. That is the most painful thing in the world. Now, you might think I'm taking it like a trooper. I'm not. I'm on such medications. They're giving medications like every 7 minutes. They were giving it 5 or 7 minutes.
5 minutes.
Now I'm just doing a lot better actually. I'm able to go to the bathroom on my own with the chest tube in because I'm a trooper. I'm a little bit upset and discouraged because nothing got done, but I'm thankful that my life was spared and God spared my life because they had to call in a team of 3 different teams in from a cardiac surgical team, a thoracic surgeon team, and because they saw that I was bleeding from the x-rays showed there was fluid. They didn't know where the blood was coming from. So
You had your tube, your throat tube that shifted to the right.
and my breathing tube shifted. So, but I'm still in my right mind, so I thank God that I didn't have any lack of oxygen or things like that. So I'm in a lot of pain. I don't know what they're going to do because I have no chemo port, and usually the chemo port goes on the side opposite your heart, which will be on my right side, but because the tumor is there, they usually don't do that. So I don't know, and I don't want to think about all that because this is too much because it starts to make me mad about everything. So keep me in prayer. We'll find out tomorrow what's going on. So for right now, I'm laid up in the hospital. I love you guys, and God is good, and He kept me through this, and He's given me the strength, unbelievable strength to do this, because I'm in some pain, and keep my eye on the prize. Love you guys. Bye. But it is, the problem is that this is never gonna go away the pain till it's out.
Well, it might come out today.
Good.
Dr. Shapiro is the thoracic doctor. He's the gentleman who put it in.
Oh.
So his service will take it out.
Okay.
If it's not putting out anything, which is
It's not.
it's going to most likely be removed today.
Good. It was. I noticed that the lumbar, it only went up a little bit when I started shifting like a lot, and making because like I'm so uncomfortable. So I woke up upset.
Yeah, I can understandably so.
It's one thing to go wake up with a lot of pain, but get some benefit.
And get some extra stuff.
So what the heck happened? All I kept thinking about was, I kept thinking about. I was like, maybe nobody knew. I didn't know if I knew what they were doing. I didn't know what happened.
Has Dr. Hernando spoke?
I never saw him.
I know he spoke to your husband. Did your husband?
My husband, yeah, but my
I just
husband.
want to make sure what.
I'm more the medical
Yeah.
person. From I guess. Let me just. I'm doing that way, making myself like deal with the pain and pushing myself with this one. I guess there was an issue where my blood pressure dropped.
Yeah. So I'll give you the expedited version.
Okay.
But I'll try to explain everything, and then I'll let Dr. Hernando talk about the details. Anything that you want to know. You were in the procedure, everything was going appropriately, and there was a situation where you got your portacath in that you were going to get your chemo through.
Yeah.
And then your pressure started to go down, your blood pressure. And you also had what we call tachycardia, but you had a very fast rate of tachycardia.
But I always start with like a fast pulse, like in the 90s.
Yeah, but this is faster.
Oh gosh.
We're talking faster. We're talking 160s. So then we stop. We slow everything down. Anesthesia monitors you for a while. Your pressure's still appropriate. Came back to an appropriate level. You're still a little tachy, but the tachycardia resolved. But subsequently, your pressures were staying lower than we would like them to be. And at that point, the decision was made to remove the portacath because
I can't believe it.
Yeah, because we got a chest X-ray, right? And the chest X-ray, we can't physically look inside of you until we open you up. So the indications on the chest X-ray would lead someone to believe that you might have had fluid on your lung, which, given that you're in an operation, blood would be the most likely fluid there. There's other fluids that can be there.
Right.
So that's when we made the decision to put in the chest tube.
But doesn't fluid go in your lung anyway during an operation or no?
No, not typical.
Oh, unless, like he was saying, one of the possible risks was that you puncture that part.
Yeah, so essentially
You're feeling.
The easiest way to put one in would be on the side where your breast cancer is. But Dr. Hernando wanted to avoid that area, and you have to thread it through, and there's a little more invasive process to do that. Okay?
I didn't know you were threading it through on that.
Well, threading might not be the right word, but it's not a straight path. There's some maneuvering
Of course.
that has to be made to get it there. So everything was going fine. We looked at studies to show that everything was where it needed to be, but with the pressure dropping and the tachycardia, we have to put the patient first always. So at that point, we decided that it would be appropriate to get a chest X-ray. Chest X-rays show what we would call a whiteout, or it looks like you have fluid on your lungs. That's the colloquial term is whiteout.
But it also could have been inflammation too, right?
Could be.
Because I have that autoimmune, but yeah, but then it wouldn't have been on. It would have been on both. It wouldn't have been like, okay, yeah.
It was an issue of, this is an operative setting. What are the most likely causes of something to happen? And we have to be very judicious and cautious in how we move forward from there. So after the chest X-ray was obtained, we decided that the most appropriate level with consultation was to do a chest tube. So Dr. Shapiro, he's a thoracic surgeon. He's the gentleman who put in the chest tube. But we didn't get any return off the chest tube, obviously. Which is a good thing and a bad thing, right? It's a bad thing because you have one, you don't want one. But the good thing is a serious etiology is not the cause
Right.
of what was going on. So you didn't have a lung bleed,
Right.
essentially a bleed into the lungs.
And I am coughing. I'm making myself cough.
Mm-hmm.
And I'm doing this every hour. And now I'm finding myself that I'm starting to, the more ice I drink,
Mm-hmm.
the more I'm able to produce like a sputum, like it's coming up.
Mm-hmm.
Nothing like that, but I'm able to clear my throat.
Yeah. So don't beat us up, because everything was done
Yeah,
for your safety.
yeah, no, I know that. My issue now, of course, I'm concerned is where do we go from here now?
Dr. Hernando would be the man with the plan. I'm not going to comment as to what
Yeah.
staging of what he thinks should be appropriate. And you know, you normalized in the operating room, but given all that happened, and would you really want to take a chance proceeding
Oh, no,
at that
no.
time?
So it wouldn't have normalized even with it in?
It, yes and no.
Could have,
There's
and you
not-
didn't take a chance.
Yeah.
And what
I'm
happened
not
here?
I'm not a.
I realized I had something here, like
Oh
my
yeah, that's how
jugular.
the catheter works. It's a tunneled catheter.
Oh, I didn't know it goes from there to the jugular and goes
So
all the way down.
what happens is it has to be clean.
Mm-hmm.
So it has two entry points. We make two entry points and we tunnel it in. And it comes out through another one. And then you get one. If it was still here, you'd have one stitch here, but you would only
Can you stop touching those?
Okay.
Okay.
Yeah, but it's not there. But you would have. This is appropriate. This is
Okay.
normal.
My only other concern is that I didn't get any other order for like an antibiotic. That's always a concern for me with foreign things in me.
Well, we're very sterile when doing the procedure.
I know it has nothing to do with you guys. It's to do with me and my body. Likes to. But I had no fever, so that was good.
Yeah, no indication for extra antibiotics. If Dr. Hernando felt that, given the situation, antibiotics were warranted, he would do it. I know you went in expecting one thing and came out with another, and I apologize. Sometimes that's the nature of the beast. And in the operating room, we have to always put the patient first and do what is best by them.
Yeah, my husband said that a couple of different, care teams came in to look to see, and I guess you have those machines. I didn't even see those other machines there.
Yeah, the fluoroscopy machine.
Oh my
the
goodness.
X-ray machine. There's all kinds of machines.
Oh, so it was able to do more like a 3D view from behind and in front.
Well, they're different machines. Fluoroscopy is essentially, think of it as an active X-ray. That you can see the X-ray image constantly upgrading. So it's more like a movie. And it can do normal X-rays too. And then there's the standard plate X-ray as well. But Dr. Hernando will be out, and he'll speak to you more thoroughly. I just wanted you
How soon into it did it start doing that?
It was probably 40 to 45 minutes into the case. Like everything was in, and then it started going, and then we have to pause and break and put you first.
Yeah, I appreciate that. That's why I said I woke up alive. So I appreciate that. That you stabilized me. When I think about it, makes me nervous.
No, try to get some semblance of rest.
Well, that's what I was doing. What I've been doing is making myself in a sleep state. This is, I must be a trooper. These things hurt.
Yeah.
There's no way to make it better because it's just hard and it's firm. How do you keep it in? Do you stitch it in?
Yeah.
So how do you take it out?
You take out a stitch.
While the person's awake?
No, it's already out. Your port is out. You don't have a port.
No, I mean the chest tube.
Oh, the chest tube?
How does it stay in?
Yeah, it's a stitched in as well.
Yes, how do you take it out?
They unstitch it and pull it out.
While you're awake?
Yeah.
Oh my gosh. Okay.
But talk to Dr. Shapiro, because he's an expert. And he'll be able to walk you through what they do for pain control and sedation and all those kinds of things, okay? They do a very good job of managing the pain.
Well, I appreciate the fact that you guys saw that I was in, potential trouble. You don't always know. And then I also have, severe asthma. But I've been, actually, like I said, besides this, I've really been doing the work I need to do. I went to the bathroom on my own. I've been walking, making myself, so I was like,
I'm going to come to this side because I feel like I really keep breaking that.
I was like, I'm going to make myself stronger today. They're gonna take this out. So what are the things that make them keep a chest? Like, it's not keeping my, it doesn't mean my lung will collapse if you take it out.
No. There are many indications for getting a chest tube or getting one.
Mm-hmm.
Your indication was the plate looked like it had blood. We needed to drain blood potentially. No blood to come out really. The blood that's in there is probably a very scant amount from the actual insertion of the tube, because you do have to cut through some planes of tissue to put the tube in place. And then it's maybe some minor bleeding,
Right.
very, very, very slow venous, that you wouldn't put a chest tube in for.
Right. I see it's like over 12 hours, and that's all.
But the issue is, you only get a snapshot of time in the
Right, to make a critical decision.
Given the information given and what is the safest outcome for the patient. So this was the safest avenue for you, and that's why you have it. But it will most likely come out today. If not today, definitely tomorrow probably. But Dr. Shapiro will give you a more exact date.
I am to come on the 6 o'clock round. I need to come at the 6 a.m. rounds. I can bag on, get this out, and start healing. But other than that, like I said, I also asked for my inhaler only because, I have acute onset asthma, and when I feel myself like a little bit of wheezes, it's really not so much this, just the setting. Like I'm laying flatter on my back at home.
Be up, right, a little bit more. Let your nurse know.
No, everybody's fine. Everything's fine. I just want to for me, I'm just thinking ahead. Like what the heck next? Because
don't get in that zone.
I know I'm trying not to.
This is not the time to zone. The next step is right now. That's the step for now.
You gotta remember, my life just in the last 60 days, it just went like from.
I don't know, but I can understand, right? Not minimizing what you've gone through in the last very short period of time. But right now, in this moment, it's important to be in this moment, because this is where you are. We want to make sure that you're healthy. We want to make sure you're safe, and we proceed appropriately for you. Okay?
And what's crazy about my heart rate being so fast like that is that I've had cardiology studies done in my heart, because I'm always feel like I'm a hyper person, but I always had and even you saw I got the echocardiogram done, and everything's normal on my heart. I don't know.
Yeah. But let your nurse know if you have any more questions.
Yeah, no, I'm
They'll get in contact with me. I unfortunately have to run into patients. And then in terms of Dr. Hernando, he should be in later today. And we can get a hold of him. He can come by and speak with you, as well as touch base with all the other team, meaning Dr. Shapiro, who put in the chest tube.
Thank God he was around. Well, I guess at the hospital, they're always around. Thank you. Bye.
You want this light on? I'll do it like this so it can dry out.
Yeah, thank you. It's about 6:30 in the morning on Wednesday, September 2nd. Struggling with this chest tube. A lot of pain. The good news is God is so awesome. One, I'm alive, and two, the thoracic surgeon just said that they're going to be removing it. And I asked, how am I going to be awake? And I am. So pray for me as I go through getting it removed. It's supposed to hurt only for a couple of seconds or a minute, but what I'm going through right now with this tube, there's no way to get comfortable. It just hurts. Something else to say about it. So I'm not sure what the rest of the game plan is. I'll find that out later on today. As you know already, no chemo port was put in. No biopsy was done because I didn't stabilize on the table. I went into tachycardia, low blood pressure as well, and they had to do other techniques to make sure that I'm okay. And my lung wasn't punctured because they saw on the x-ray there was a lot of fluid. All right, my medicine's kicking in that I need. So, love you guys, and thank you for following me on my journey and being part of the journey with me to help educate other people, the women, about breast cancer. Survivor mode. Survivor can't look. Wait. Survivor mode. Good morning, fine peoples. It is almost 7:30 in the morning, September 2nd, and I am walking down the hallway because with a chest tube in because I'm getting this out. The pain. I'm just in a Jesus trance right now. So I'm gonna show them I can do this. Get this chest tube out and get back to healing. All right, guys. Keep me in your prayers. Survival mode. Hey guys, good morning. It's September 2nd, 2015. It's 8:45 a.m. and the chest tube is out. Yay! Video's gonna be kind of quick because my dilaudid. They just gave it to me and it's a special kind of drug. So, I'm gonna cry about it because first, I thank God that He spared my life and everything is well. Could have been worse. Could have been worse. So, but God. So, I'm back at square one. I've got to get both procedures still done. I'm gonna go home today probably, let my body heal, and then I'm going to go to a thoracic surgical suite as an outpatient, and they'll put the chemo port in because according to my surgeon, my anatomy is a little difficult where it's not ordinary, so it doesn't feed and everything else the right way. So they had a problem with that. So what happened was the breathing tube that's put in, and the anesthesiologist was put in, where it shifted. It wasn't put in the right way, and so it looked on the. So when my blood pressure dropped, everything happened. They didn't find out till later on that it's my breathing tube. The breathing tube which shifted. It was put in, shifted over to the right, so my left lung wasn't getting any air at all. So it was just completely, like what they said, where it shows that it's either air or blood. They didn't know what was going on, and the split decision they had to make. They preserved my life. So I still have to get the biopsy done. We're going to talk with my oncologist to see if they can push chemo back one more week to give me a chance to heal. Because the chest tube, I have a hole on my side now that has to get healed. That takes a couple days for that, but I'm sore because of the muscles, and it's by the, I think I said the pleural muscles or something like that. So if I said it right, or pleural or plural, I don't know. Anyhow, I'm eating, so I'm about to eat breakfast, and I'm walking, talking, everything's good. I'm just a little frustrated, guys. I want to get this started. I do, and I don't want to get it started. I just got my mind wrapped around going next Tuesday to start chemo, and now I don't know. It just hasn't been easy. It's just one battle after another. It's a little tiring. Trying to see the greatness and the goodness and all this, because God is good, and he said it is well. And so anyway, I'm going to smile and be thankful and grateful to God. And for you guys, thank you for your prayers. It does make a difference, because do you see who I am today as opposed to 2 months ago? It's only but God and prayers. So thank you. Keep them going and keep them coming. And I'm going to let God do his part, and I'm going to do my part, being obedient to what God tells me to do. So I love you. Thank you for thinking about me and just checking on my husband because he's such a strong guy. He's never going to ask for help. So make sure my husband's okay. And that makes me feel good. Okay? Love you guys. Survivor mode. Howdy! So, it is Wednesday, September 2nd, 2015, and it's about almost 5 o'clock p.m. And I'm feeling a lot better, as you can see. Chest tube's out. Still sore there, but I'm working out the muscles there, walking up and down the hallway, taking deep breath, yoga stretches, and stretching out. Right now, I'm just eating some dinner, having some catfish and some rice and carrots. Tomorrow, I'm back into surgery. I'm on the schedule for surgery, and the vascular surgeon is going to install the chemo port. They specialize with working with veins. So right now, I'm a little bit sore. I got one in my jugular. I guess that's a jugular vein. And it said the chemo port was here, but they had to remove it when I didn't stabilize. So they're going to go back there tomorrow, put that in. I should have that done. As far as the biopsy for the nodes and lymph node dissection, not sure when that's going to be scheduled, but we're trying to get that done before chemo starts on Tuesday. So other than that, all is well. I'm in pretty good spirits right now. I am still in a little bit of pain from the chest tube, but again, working it out. It's expected. And my head's back in the game. And my husband's with me all day. And he's getting ready to leave. We're here right now. There's the heart monitor, just making sure that the ticker is working well, which it is. And got a central line going on up here for tomorrow. We see that. And that's it. So thanks for the calls and prayers, texts, everything, visits, everything. Love you guys. Just letting you know what's going on and where we're at. And we'll talk to you guys soon. And Tony will keep you updated tomorrow with the surgery. Good morning, everybody. It's September 3rd, 2015. It's about 11:40 in the morning, and I'm on my way to surgery. Surgery 1 of 2. So the plan is today, I'm going to get the chemo port put in again. And then tomorrow, I have the biopsy done and the lymph node dissection, possible dissection done tomorrow. So I'm on my way. My husband's here right now. And I'm in pretty good spirits. I was a little bit frustrated because of everything being split out. So I'll be here till Saturday probably. They're going to keep an eye on me. Got a little bit of an infection that's trying to start up with my, probably from the throat irritation from the tube. Coughing up a little bit of phlegm. So there are going to be some antibiotics. And right now, just keep your prayers that I will make another video afterwards. And yes, I did do my hair because I gotta look beautiful going to surgery. Yes. God is good. Survivor mode. We got this, right? You guys got my back, right? You're praying for me, right? So I know I'm gonna be okay. See ya. Hey guys, it's Penny. It's about 4:06 p.m. on September 3rd. It's a wrap. No surgery today. It'll be tomorrow. Look at Tony's face. They're going to do everything tomorrow. The port and the biopsy. Apparently, I guess it got backed up. Listen, we're not going to rush these things. God knows everything. So we got to start all over again. I'm starving. I just want to go eat. So, and Brother Gerald's over here. He mad. Brother Gerald, what you say? What you say? What you say?
It's all good.
It's all good.
All good.
We rather wait and have it done right. So tomorrow, gotta start up again. What does God teach me? Patience, right? You know I'm the most impatient person. So keep the prayers going. Tomorrow morning, 11:30. Vascular team on the left side, surgical team on the right side. God above all of us. Love you guys. Survivor mode. To God be the glory. Thank you, God. Woke up, no complications. A little loopy, but a little bit of pain, but it's good. So chemo starts Tuesday. Yay.
You just got on your recovery.
Hi, baby. So, just got recovery. I'm in the recovery room, and All is well. God is good. We're doing this, guys. Survivor mode. Thanks for the prayers. My good peoples, September, what day is it? 6th. It is 1:20 p.m. and I'm out of here. Bye, hospital. Bye, hospital bed. Bye, people. I took good care of me. My husband and my grandson are ready to take care of me. Let's do this. Survivor mode.